It turns out that in recent years, neurobiologists, clinical researchers, and mental health professionals have discovered that a number of ancient practices, mindfulness practices that have been refined over the last 2,500 years or so, turn out to be extremely useful for helping us to work with all sorts of everyday emotional difficulties. Everything from anxiety and depression to serious difficulties like chronic pain or perhaps relational conflict. And in a few minutes, I'm going to teach you about some of those practices and show you how you can use them in your own life. But in order to use those effectively, it's very, very helpful to have a sense of how come life is so difficult for all of us in the first place. Well, it turns out that we didn't actually evolve to be happy. Our brains developed primarily as organs of survival, the same way the other organs in the body developed. And to understand this, it's helpful to look back at our past. And let's start by looking at Lucy. This is an artist's conception of our great-great-great-great-great-great-great-great-great, etc. grandmother. And she was hanging around on the African savanna somewhere between 3.5 and 4.5 million years ago. There may be an earlier common ancestor, we're not sure. And we know that she survived because we've got her DNA. But how did she possibly survive out there competing with the other wildlife? Imagine her coming face to face with a lion. What could she do? Well, she could grit her teeth and bare her claws, but that probably wouldn't be too effective. She might try to rely on her hide for protection, but that's pretty limited. Her fur was sillier still. You know, she wasn't very fast. One of the first things that you learn if you ever go on a walking safari in Africa, and there's, a couple of guides usually, and they've got big guns, and they say to the tourists, please, 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 no matter what happens, just don't run. Why? Because everything scary out there is faster than you are. You see that half-blind hippopotamus? That half-blind rhinoceros behind those trees? 38 miles an hour. That big lumbering hippopotamus in the mud puddle? 42 miles an hour. And furthermore, if you run, everything that's a predator is going to think you're prey, and it'll make matters worse. So she couldn't escape. She had reasonable sight, not as good as an eagle or a giraffe, but better than the rhino. Reasonable hearing, a lousy sense of smell, just ask your dog. How did she possibly make it? Well, she basically had a few things going for her. She had a fight-or-flight system that was capable of emergency response, and this was inherited first from reptiles and refined more by mammals. And she also had, on top of that, a prehensile thumb, an opposable thumb that could pick up objects, which was really, really good for using tools. And if you've ever seen your dog try to use a tool, you understand how useful it is to have a thumb. And the other thing that she had was she had a capacity for thinking about the past, analyzing what had happened, and projecting it into the future. And it's this third capacity that helped her enormously and also gets us into a lot of trouble. Because it turns out that this ability to analyze the past for pleasure and pain and try to maximize future pleasure and avoid future pain isn't some kind of neutral computing apparatus. It's actually subject to something called the negativity bias. This is how cognitive scientists refer to it. If you think of Lucy's predicament out there, she could have made one of two kinds of errors. And we could think of these as a type 1 and a type 2 error, kind of analogous to the same kind of errors that we use in scientific research. She could have looked at a bush with a beige shape behind it and think, oh my God, it's a lion, when it was really just a beige rock. Or she could have looked at the same shape and said, it's a beige rock, when it was really a lion. Now, Lucy could have made thousands of type 1 errors and still lived to propagate her DNA. But if she made just one type 2 error, that's the end of her DNA line. So we develop minds and brains that are really, really good at these type 1 errors. Our minds, as my friend Rick Hansen puts it, are like Velcro for bad experiences and Teflon for good ones. Anything bad that happens in our life sticks, the good ones slide right off the pan. If you meet with your boss for a review and you hear about 9 things that you're doing great, and your boss tells you about one area of insufficiency, what are you going to think about at 3 in the morning? It's not the 9 things that you're doing so well. And there are countless examples of this. Even other animals do it. If you run a rat through a maze, and at the end of a given pathway give it some food, it's got to go through that trial several times to learn the pathway. If at the end you give it an electric shock, one trial learning, that's all it needs, and it remembers this. even in couples, there's a couple of psychologists by the last name of Gottman in the Seattle area, and they study couples. And they find that on average, we need 5 warm and fuzzy interactions with a partner to undo the loss of trust that comes from one fight. So the mind has this very strong negativity bias. And then we're going to enter into a systematic way of addressing the fear, stress, and other psychological factors that can cause or perpetuate these disorders, and to help you to resume a full, normal, engaged life. Finally, we'll look at how negative emotions, various feelings of anger, fear, frustration, and the like, can actually be contributing to disorders. And what you'll see is that mindfulness practices can support us in every step of the program. Maybe not so much in getting a good medical examination, but certainly in the other steps. You'll even learn how to use the insights gained in recovery from these disorders to deal with other problems in your life, since it turns out that the very same principles that can help us to deal with stress-related disorders are helpful for dealing with a whole wide range of emotional as well as interpersonal challenges. Now, the kinds of problems we're going to be working with go by different names. Sometimes they're called mind-body disorders, sometimes stress-related disorders, sometimes psychophysiological problems. There's an older term, psychosomatic disorders, which is so broad that it doesn't have a very precise meaning. The important thing to understand as we go forward is that just because it's a mind-body disorder does not mean it's in any way imagined or not real. These are all very real medical conditions, but they're caused by or maintained by psychological factors. Depending on the criteria researchers use, the estimate is somewhere between 60 and 90% of all physician visits these days, at least in the United States, are for stress-related disorders. They're the main reason people visit the doctor after upper respiratory infections. What's very interesting is if we've had one of these stress-related disorders, there's actually a very good chance we've had others. Let's see if that's true for you. Take a moment right now to reflect on which of these disorders might have afflicted you at one time or another. Again, while these conditions have many causes, they can all result from or be maintained by or perhaps exacerbated by psychological processes. Let me give you a kind of comprehensive list and just listen and see, have I had these before in my life? Recurrent headaches. Have you had heartburn or sour stomach? Perhaps intestinal cramping, or unexplained diarrhea or constipation. And then there are the various pain disorders, musculoskeletal disorders. For example, have you had chronic neck pain that just didn't seem to go away? Or chronic back pain? Or perhaps chronic pelvic pain that lasted for a while? Or knee or shoulder pain? And then there's habit problems, like have you had difficulty sleeping? Perhaps getting up in the middle of the night and finding it hard to get back to sleep. Perhaps finding it difficult to fall asleep. Or sexual difficulties. These come in so many varieties. There's the difficulty getting or maintaining an erection, premature ejaculation, lack of sexual interest, or difficulty reaching an orgasm. Have you had skin problems like persistent itching, or maybe eczema or hives? Or perhaps have you experienced ringing in the ears, what's called tinnitus or tinnitus? Or has your dentist ever told you that you grind your teeth at night, often called bruxism? And another habit, do you notice that you bite your nails or pick at things on the skin? Have you had jaw pain or tension, what's called temporomandibular joint disorder? Or simply unexplained fatigue, maybe frequent colds and sore throats? Or certain kinds of asthma? Now again, all of these disorders can certainly have medical causes that have nothing to do with what's happening in our minds. You can have chronic neck pain because you've just been in an automobile accident, or back pain because you've just shoveled snow. Actually, the truth of the matter is they don't tend to be chronic after these instances, after these kinds of things that can create them. When they become chronic, that usually has more to do with the psychological factors. But certainly other things. You could certainly have ringing in the ears because you've just started taking aspirin or ibuprofen. You can certainly have unexplained fatigue because you have a viral infection. So I don't want you to think that I'm saying that these are all necessarily psychophysiological. But it is interesting that psychological factors can contribute to any of these problems, and they can maintain them. And sometimes, simply looking at the list of problems and reflecting on whether they've affected us personally can give us a clue as to whether stress tends to play a role in our body's maladies.